Mexico schools struggle year after year with low graduation rates and test scores. Now, there are many people working hard to improve the outcomes for students, and one area of focus is improving the health of students so they are ready to do their best in the classroom. There are currently over 70 school-based healthcare centers operating across New Mexico, but cuts in the state budget for the Department of Health have concerned some health advocates. We'll hear more about that in a few minutes when our producer, Sarah Gustavus, sits down with the head of the New Mexico Alliance for School-Based Healthcare. Now, after we talked about school-based health last month on the line, we had a lot of questions about how the clinics operate, how the clinic staff interact with students, parents, and teachers. And Sarah recently stopped by Highland High School in Southeast Albuquerque to get a look inside one clinic.
It's just important to take care of your own health and everything. I mean, especially once you're starting to get to high school, you should probably start just easing over to taking care of your own health.
It's almost like a family here because of how, they're very open, they make friends with you and they just make you feel very welcomed here.
We can have you sign one of these forms.
I typically see about 8 students a day, and depending how long those visits go, I can see more or less. But I might have a student who walks in and I'm seeing her for a head cold and she's just not feeling well, but it turns out she is really having some depression issues and just a hard time in her life, so I can refer her to our therapist who is here.
Poverty is a reality, and with poverty come really adverse situations and the grander opportunity that we have to deal with them inside the schools.
We kind of work together to make sure that the students get the care that they need. We have a huge population of immigrants and refugees, and sometimes language is an issue in accessing care. So it's a very quick way to get those students in, at least initially, until they are able to access care in the community.
Really, our vision is the same as the schools. We want kids to graduate and be able to go to school and do well in their classes. It's really hard for them to do well in their classes if they're hungry, have big problems at home, are feeling sick, are depressed, things like that. So our vision is if we work on those issues, that students will be able to do better in school and graduate. Young people are interested in their health, but they do have a focused gaze, so they're concerned about issues around birth control and sex ed, around mental health, depression, things like that, relationships. They want to talk about all those issues, whereas exercise, nutrition, things like that are less exciting for them, I guess, so they're not as likely to talk about it.
We do offer confidential services by New Mexico state law. Any person essentially 13 and over can consent for confidential care around birth control, STD prevention, mental health, substance use, these kinds of things. However, that said, we always encourage them to include their parents in the discussion and even offer to facilitate that discussion for them or role model that discussion for them. Or if that's not possible, identify a safe adult in their life that they can confide in.
It makes you practice your independence by coming here and doing what you need in coming here. It made me feel more confident in going places and asking for things, because it's like you know that you need it and you go there and they give it to you without questioning it. So it gives you more thought into what you need.
Nancy Rodriguez, thanks for sitting down with us this week.
My pleasure.
We just learned a little bit about Highland High School and their clinic. How typical is that for school-based health clinics across the country?
Well, we have a saying in our field, if you've seen one school-based health center, you've seen one school-based health center. So they're all a little bit different, and that's appropriate because they're trying to meet the needs of their specific school, their specific community. But I think the thing that is probably the most same about Highland High School School-Based Health Center as others is that they have an integrated care model. That is the exemplary model that is across the nation recommended, where behavioral health and primary care are integrated for the benefit of the young patients, whether that's a second grader or a high school student like at Highland.
Highland also recently received some recognition.
Yes, our organization for the first time this year decided to do Exemplary School-Based Health Center Awards to let people in the community know about the great work that's going on in school-based health centers and to show unique and innovative ways school-based health centers can provide care so that other school-based health centers can model some of those innovations. So there were two high schools this year that won that award, and Highland is one of them. So last week at the annual Head to Toe School Health Conference in New Mexico, we gave them the first annual School-Based Health Center Exemplary School-Based Health Award for some of the reasons that you guys featured. Their extreme collaboration with their school staff and the school nurse that you guys talked to and the school principal. They have a really collaborative approach to meeting the students' needs, and they actually do something a little bit unique, not only in our state but nationwide, in bringing case management services to the entire family represented by the student in the school-based health center. So we felt like it was appropriate to give them an award so other people could copy their great practices and so that they would feel supported in the work that they're doing.
Let's talk some more specifics about what happens in clinics. What can school clinics provide that school nurses can't? How is it different?
Well, typically, at least in New Mexico, school-based health centers are staffed by a nurse practitioner or physician's assistant, so they have a higher level of licensure, so that means they can provide other kinds of services than a nurse can provide. And as I mentioned, they also have an integrated model, so they would typically have a social worker, some even have visiting child psychiatrists to support high needs in behavioral health. So often students come through the doors with a primary care need, but because, at least in our state, there is a screening of behavioral health needs, they might also get a warm handoff to a behavioral health provider or referral to someone outside in the community to meet those needs as well.
The staff mentioned when I was meeting with them that students are very honest in their assessments, maybe because it's on an iPad?
That's right. We had a project in this state funded by the Centers for Medicare and Medicaid Services a few years ago that I was actually involved in, working with the state of Colorado to look at best practices. And our state for many years has had a student health questionnaire that has embedded in it everything from injury and risk prevention questions to behavioral health screens. And one of the innovations from that CMS funded project was to put that in an app feature, and research shows that when students have an electronic format to share that information, they're more honest. So they complete the assessment typically in the first visit or within the first week of their first visit, and then that information goes electronically to their provider to determine what the highest needs are, what do they need to talk to them about, do they need to then be referred to a behavioral health provider for a deeper assessment for everything from depression, anxiety, violence in the home, that sort of thing. It's really a great tool, and youth are usually better at technology than us adults, so they really find it user-friendly.
We also heard from the students and from the providers in the clinic that students are coming, seeking birth control. Some students are, or those kinds of services, and that's kind of difficult for some parents to hear. We've heard parents say that they don't want that, or they're concerned about that. What can those clinics provide compared to any other doctor's office or clinic in the state?
Well, it varies to some degree. In our state, as the provider at Highland High School explained to some degree, we have confidential services laws. So adolescents at a particular age are allowed by law in our state to access behavioral health and reproductive health services without their parents being involved. And that's no different at a school-based health center than it is at any other clinic. However, in our state, a school-based health center only provides reproductive health care with the permission of the school board over the school where the school-based health center is located. So not every school-based health center provides reproductive health care. They will often refer out if they are not able to provide that care, but the confidentiality is under state law, and so that's no different than if they went to a community clinic anywhere in the state.
I can also imagine some people might say, parents need to take care of this. This is not something schools and teachers, they have so much to do already. Why would you add something else on by putting a clinic in the school?
Well, actually, what we have found and what research nationwide has found is that providing a clinic in the school actually reduces the burden for school staff and for families. Particularly in rural areas that we have many of in New Mexico, for a student to attend a healthcare appointment not in the school could take a half day or a whole day away from school. That means a parent who perhaps can ill afford to take that much time off of work is losing that work time, potentially losing that salary during that time, whereas they may have no missed work time if their student gets that care in a school-based health center. And Students and teachers are likewise concerned with out-of-seat time and missing school time, particularly with the high stakes in our education system right now. So a student might miss one class period as opposed to a whole day of school, so it really is in the best interest of the school as well. And school-based health centers are naturally, and we recommend this, typically collaborative with their school staff, so they try to pull students out for appointments when they are not in a class that they're struggling in, for example, or a core academic class, but maybe they're electives or during lunch. And some school-based health centers are open before and after school, so they can accommodate students then as well.
Department of Health announced recently that some clinics are going to close this year. There's been a reduction in funding. What does the future look like for school-based health, especially the finances?
Well, one of the things that our organization works on is financial sustainability. Preventive care can be more time consuming, which means it's more expensive. So we're constantly working with school-based health centers to try to support the work they're doing to get kids signed up for Medicaid or for insurance, so as much of their time is billable as possible. So that's a technical assistance support that our organization provides. Not all school-based health centers in our state get financial support from the Department of Health, and even those that do, it covers usually a quarter to maybe a half of their operating costs. So billing is important. Seeking outside funding from other resources like community foundations is really important, and we're trying to support them in that as well. I think most folks in our state know that it's not a great time for state budget issues, no matter what the department is, and the Department of Health has had that same challenge that other departments have had, so they have made these cuts. But I will say one of the confusing things for the community has been to hear that there are closures. The Department of Health doesn't close school-based health centers, they cut contracts. Schools and communities close school-based health centers. So I think there's still activity in a lot of the communities where those cuts were announced to try to bring resources to bear to keep, if not a traditional school-based health center, some kind of health care access for kids, and we're trying to be supportive in that.
How do you measure success for school-based health clinics?
Well, there's some ways that school-based health centers measure success that are the same that any clinic would, and a lot of those have to do with clinical outcomes for young people. And then there's other things that I think school-based health centers do even a better job of than maybe other clinics, and patient satisfaction is one of those. Across the nation, school-based health centers serve 0 to old age. They're often open to the community. In our state, the services are concentrated with adolescents, and I think it's really important for adolescents as they're building their health literacy and going on to take care of their own health care, that they are an integral part. And in our state, youth engagement and youth health literacy is a big part of school-based health centers. So at least the DOH contracted sites are required to do a patient satisfaction survey. And students always rate school-based health care higher than they do care that they get other places in the community. I think that's a really important metric of success. They also typically say in surveys that they are more likely to take the advice of the providers in school-based health centers because they feel there's a youth-friendly approach. The other thing that the Alliance has done, our organization, in the last couple of years is do a return on investment study. We commissioned a management consulting firm to look at what the financial return on investment is for school-based health centers, because as many wonderful stories as I could tell you about the care that kids get in school-based health centers, people are really concerned with limited resources what the care they're buying is, particularly when we're using taxpayer dollars. Our research on even just a limited number of care indicators was that for every dollar the state spends, they're getting $7.01 return on everything from decreased ER utilization to better academic outcomes and therefore better professional outcomes for young people. So we feel like they're care outcomes, educational outcomes, financial outcomes that we hear from students are really important to them, their families, and that we hear from schools are really important to them because they're all contributing to a shared mission of success, happiness, and health for kids. And that's what our organization is about too.
Nancy, thanks for taking the time to talk with us a little more about school-based healthcare.
It's my pleasure.